Hello, and welcome to this presentation around travel and cancer. This presentation is about travelling for people who have been affected by cancer and is applicable for those planning a trip or holiday abroad or in the UK. During this presentation, we will discuss planning ahead, travel insurance, taking medicines abroad, and looking after yourself while you're away. We hope it helps you deal with some of the questions or feelings you may have. We cannot give you advice about the best treatment for you, and we will not discuss about going abroad for cancer treatment. This is something you should discuss with your doctor. There are many benefits of travel if you've been affected by cancer. A holiday is a chance to rest your body and mind, but there are also other reasons you may need or want to travel. For example, you may want to travel for spiritual or religious reasons, for work, or to visit family or friends. Travelling can also help you feel more relaxed and positive, allow you to spend time with people who are important to you, and can help you become more active and improve your health. Before making any plans, it's always best to talk to a professional and seek advice. They can help you to discuss the following: safety of travel, suitable destinations and side effects of treatment, vaccinations, arranging medical supplies, taking medicine abroad, and any problems you may have whilst you're away. Many people who have cancer can travel without problems. For others, cancer or its treatment may make travelling more difficult. How cancer affects your travel depends on different things, including the type of cancer you have and how it is treated. Some things you may need to think about are: cancer and its treatment can cause symptoms or side effects. These can make it more difficult to travel or cause problems while you're away. You may need to take medicines or medical equipment with you. Travel insurance is usually more expensive for people living with cancer. And if you want to fly, you may need a fit to fly certificate from your doctor to meet the airline's requirements. Planning ahead can help you avoid these problems. It is important to speak to your cancer doctor, specialist nurse, or a travel health professional before you make any plans or book any travel. They can tell you whether travelling may be unsafe or explain how to prepare and what precautions to take. If you are still having treatment, your healthcare team may be able to help you plan a safer trip. For example, it may be possible to change your treatment dates or arrange a break in your treatment. Cancer symptoms or the side effects of treatment may affect your travel. Knowing how to manage these can help make your trip safer and more enjoyable. Some cancer treatments can affect your immune system and increase your risk of infection. These include cancer drug treatments such as chemotherapy, immunotherapy, and some types of targeted therapy. If you want to travel while having treatment, talk to your cancer doctor, specialist nurse, or travel health professional. Your risk of serious problems from an infection may be higher at certain times. For example, you may have a higher risk during treatment, for a few weeks after finishing treatment, or for up to a year after high-dose chemotherapy for stem cell or bone marrow transplant. Your risk of infection also depends on where you plan to travel. If you want to travel abroad, ask your cancer doctor for advice about your risk of malaria and other diseases that may be common in that area. You may be able to have vaccinations to help protect you from some types of infections in other parts of the world. You can reduce your risk of infection by washing your hands regularly, following food and hygiene advice, and being careful what foods to eat. You should also try to prevent insect bites if you are at risk of lymphedema, and should contact a doctor as soon as possible if you think you have any infection, swelling, or high temperatures. Fatigue is a feeling of tiredness or exhaustion. It is a common side effect of cancer treatment. Fatigue can sometimes continue for months after treatment finishes, and for some people it may be an ongoing symptom of cancer. Fatigue does not have to stop you travelling, but it is important to think about how much activity you can manage and how to pace yourself. Try to plan when you will rest between activities. You can usually arrange help at airports, train stations, and on ships. For example, you could arrange to have a wheelchair so you do not need to walk as much. Radiotherapy, chemotherapy, and many other cancer drugs can make your skin and eyes more sensitive to the sun. And it is important to know how to protect yourself in the sun and keep your skin healthy and safe. The risk of blood clots are higher after surgery. It is recommended to wear compression stockings for travel. These are below the knee stockings that keep gentle pressure on your legs and help blood flow. They are important if you are going on a flight of 4 hours or more. And make sure your compression stockings are properly measured and fitted for you. Other tips to help reduce the risk of blood clots include booking an aisle seat, especially on flights, to make it easier to move around. Wear loose-fitting, comfortable clothing, especially around the waist and groin. When sitting, exercise your legs, feet, and toes every 30 minutes. Walk around when you can and try to walk up and down the aisles for a few minutes every hour. Try some upper body and breathing exercises as these can help improve your circulation. Avoid taking sleeping pills and drink plenty of water, and avoid drinking too much alcohol or caffeine as these can dehydrate you. If you have recently had surgery, your doctor will advise whether it is safe to travel or how long you should wait before travelling. They can also tell you if there is a type of travel you should avoid. Remember to tell your travel insurance provider that you have had surgery and ask them whether this will affect your insurance cover. After some operations, you are advised not to fly for a while, and it's important to always follow your doctor's advice. Some cancer treatments can cause long-term effects. These are side effects that do not go away after a few months or that start months or years after your treatment is finished. These can include lymphedema, spleen removal, stoma, bowel or bladder problems, tracheotomy or laryngectomy. If you have lymphedema or are at risk of developing it, planning can help you manage any problems and enjoy your time away. If you have a lymphedema specialist, talk to them about your travel plans before you go. Some useful things can help you prepare for your trip include having any vaccinations before your trip and avoid having injections in the affected limb if possible. If you are planning a more active holiday, talk to your lymphedema specialist before you travel. They can help you give you advice to help you protect the affected area. Ask your specialist for information about lymphedema and air travel. If you are flying a long distance, you may need a compression garment. Ask if there are any exercises you should do while you are traveling that can help prevent the buildup of fluid in the affected area. Ask your GP or lymphedema specialist if you need to take antibiotics with you. This is in case you develop a skin infection called cellulitis, which can become serious if not treated quickly. Some tips to reduce the risk of getting lymphedema or making it worse during your journey include avoid sitting in the same position for the whole journey and move around where possible. If you have lymphedema in your arm, try to move it as often as you can and avoid carrying shoulder bags or heavy luggage with that arm. Do gentle stretches and exercises regularly. If you're on a long car journey, stop regularly to get out and walk around. And give yourself plenty of leg room when travelling to allow space to stretch your legs. Wear comfortable, loose-fitting clothes and shoes. Wear compression garments if advised. Use a wheeled suitcase you can pull to avoid extra strain on your muscles. Ask someone to help with the luggage, especially if you need to lift bags into overhead storage. Whilst away, you can take care of your skin by keeping it clean and using moisturiser every day, and avoid getting sunburn as this can increase swelling. If you have lymphedema in your leg, do not walk barefoot on a beach or around a swimming pool, as this reduces the risk of cuts and possible infection. If you get a cut, scratch or graze on the affected limb, clean it straight away with soap and water and put an antiseptic cream and cover the affected area. Swimming or moving around in water is good for lymphedema. You do not need to wear a compression garment while swimming because the water creates enough pressure. After swimming, shower and put moisturiser on your skin. Sea salt and chlorine can make the skin extra dry. It may be best to avoid saunas and hot baths in case this increases swelling, so keep the area affected as cool as possible. Use an insect repellent spray or cream to protect yourself from insect bites. And if you are bitten or stung, try not to scratch the affected area. An antihistamine cream or tablets can help ease the itching, pain, and swelling. And if you start to get signs of any infection, tell a doctor straight away. Signs include flu-like symptoms, a high temperature, redness, a rash or heat in the affected area, and increased swelling. And if you do have antibiotics with you, follow your doctor's advice about taking them. If you have a stoma, you may need to plan your trip more carefully. You can get information from your stoma nurse about issues such as diet and fluid intake while you are traveling, activities such as swimming, managing your stoma during long journeys or flights, how high temperatures can affect the glue used to secure the stoma bags. It's also important to make sure you have stoma supplies to last throughout your trip. If you pack about twice the amount of normal supplies, this helps you be prepared, as you may need to change your stoma bag more often than usual, or you may be away for longer than planned. It is often a good idea to split your supplies between different items of luggage in case any get lost, and always pack essential supplies in your hand luggage where you can reach them easily. If you are flying, remember there are rules about carrying scissors and liquids, so always follow the advice of the airline you are traveling with. If you have bowel and bladder issues, you can get a toilet card which will give you access to shops, pubs, and other places, and it explains that you have a medical condition and need urgent access to a toilet. A tracheotomy or laryngectomy should not stop you from travelling, but plan carefully and make sure you have all the equipment you need, and think about how to pack your supplies where you can reach them easily. If you are flying with a breathing stoma, the air can be very dry, so ensure you drink plenty of water, use a stoma cover, and speak to a professional about how best to look after yourself when travelling. Always contact your travel company and airline if you need to use oxygen whilst on a plane. It is always worth getting a travel certificate from your doctor. A travel certificate includes medical details of your medical condition. It can help explain your condition to travel officials such as airport security staff. The certificate will include your name, address, and passport number and is signed by your doctor. Some key things to consider when planning your trip. Talk to a healthcare professional is always important, as they can ensure to make your trip as safe as possible. They can advise on any issues with your treatment and give you further information for travelling. They can also provide you with a doctor's letter for whilst you're away. Vaccinations can help reduce your risk of getting certain infections. Your GP, practice nurse, or travel health professional can explain what travel vaccines you need and how to arrange them. Sometimes it is not possible to have a vaccination at all, so this may mean you cannot travel safely to some parts of the world. Some vaccinations are available free through the NHS, but there are some that you may have to pay for, even if they are recommended for travel to a certain area. Travel insurance aims to protect you from losing money if something unexpected happens before or during your trip. It also makes sure you can get emergency medical care if you need it. It is an important thing to think about if you're planning to travel abroad, but it can also be useful for some trips in the UK. It is helpful to tell travel companies in advance about any needs you have that could affect your travel. This includes travel agents, airlines, ferry companies, and tour operators. It is best to talk to them before you book your trip to make sure the right support will be available. You can tell them about any problems you have moving around, whether you need a wheelchair, equipment or medications you need to take with you, whether you are likely to need oxygen during the trip due to breathing difficulties, help or support you may need at different times during your trip, whether you are travelling with a companion, whether it would be helpful to sit in an aisle seat, for example, if you have bowel or bladder problems, and your dietary needs. Try to tell them as much as possible about how cancer affects you personally. This will help them understand what support you may need. Some countries restrict or limit the drugs that can be taken in or out of the country. Medicines you can buy over the counter in the UK may be restricted in other countries. If you are taking medicines abroad with you, it is important to check with the country's embassy or High Commission. Make sure you have medicine supplies to last your whole trip and to cover possible delays. Your doctor may be able to prescribe a longer supply than they usually do for you, but there may be a limit to how much they can prescribe. If you cannot get supplies for your whole trip, you may need to check whether you can get your medicines in the country you are visiting. You may be able to register with a local doctor or buy medicines from a pharmacist while you're away. Be aware that the quality of medicines can vary in other countries. Fake medicines may be a problem, especially if you buy supplies online or in some areas outside of Europe and North America. Fake medicines may have the same or similar packaging to the real ones, but they have the wrong or harmful ingredients in. If you plan to travel with more than 3 months' supply of controlled drugs, get advice from the Home Office before leaving and entering the UK. The guidance about carrying medicines varies depending on where and how you are travelling, and also depends on the type and amount of medicine you want to take with you. Always check and follow the advice of the airline or other transport company you are travelling with. For security and custom checks, it is usually best to carry all medicines and letters from your doctors or other paperwork in your hand luggage. Keep medicines in the original packaging because it is important that they are clearly labelled. Carrying your medicines in your hand luggage also means you have them with you if you need them during your journey. You may also want to consider carrying a supply of medications in your hand luggage and another suitcase. That way, if a set goes missing, you still have the other. It can help to keep a list of the medicines you are taking, the doses, how many times a day you take them. This will help you get replacements if you lose your medicines. Always use the generic names of the medicines because brand names can vary from country to country. If you are flying with liquids, most liquids in your hand luggage are restricted to a maximum of 100 ml, but you are allowed to carry more than 100 ml of liquid medicines if you need these during the flight. This includes liquid diets and inhalers. You must take supporting documents from your doctor or another medical professional. Always check hand luggage rules with your airline and airport before you travel. Airport staff may open containers to check the liquid medications when you go through security. It is best to keep medicines dry, cool, and out of direct sunlight. The shelf life of medicine is the period when it can be safely used. Ask your pharmacist for advice about storing these medicines when you are abroad, especially in hotter countries. You can also check with your hotels whether there will be a fridge in your room to stock. If not, you can ask whether your medicines can be stored somewhere and kept cool but not frozen. It may be helpful to have a fridge thermometer with you to check the storage temperature, and this should be stored in a fridge with a temperature of between 2 and 8 degrees. Taking medicines at the right time if you're traveling across international time zones is likely to affect the time you take your regular medicines. If the time difference is only a couple of hours, you may be able to take your medicines at the usual UK times. If there is a time difference of several hours, this may not be possible. It may be better to gradually change this time you take your medicines to fit with the local time, but always ask your GP, practice nurse, or pharmacist for advice on this. If you use oxygen, make sure you arrange any supplies you need before you travel. If you are planning a trip in the UK, you can arrange supplies for your usual oxygen provider. You need to tell them the dates you are travelling and where you will be staying. You must also check that the place where you will be staying can have oxygen delivered and stored there. If you need oxygen on a flight or cruise, check with your doctor that you are fit to travel before you book your trip. If you plan to fly, you may need a fit to fly test, and your GP can help you complete this. You should always contact your airline for advice, and it's best to do this well before your journey. They can explain their policy about taking oxygen on the plane and whether you need a medical certificate. If you are going on a cruise, contact the cruise company well in advance and tell them you use oxygen supplies. They can then advise you how to arrange this. Some cruise ships have emergency onboard medical facilities, but they are not usually free and are not included in the price of the cruise. It's important to protect your skin by using a sun cream with both a high sun protection factor, also known as SPF, of at least 30, and a 4 or 5-star ultraviolet radiation, also known as the UVA protection rating. The SPF and UVA rating measure how well the sun cream will protect your skin from the sun's rays. Always follow the instructions and reapply regularly as recommended, particularly after swimming or washing. When you are in the sun, you can also protect yourself by wearing a wide-brimmed hat, suitable sunglasses and clothing to cover up. Cover up with long-sleeved tops and trousers or long skirts. And if you've had radiotherapy, keep the treated area completely covered. Wear light, loose and comfortable clothes made of cotton or natural fibres. These have a closer weave and give better protection from the sun. And if you've lost your hair or it is thinning, cover up with a hat or headscarf to protect your scalp. If you are using insect repellent, apply your sun cream first and then spray the repellent on top. Spend time in the shade during the hottest part of the day, between 11 a.m. and 3 p.m. And if you want to look tanned, use fake tanning lotions or sprays instead of sunbathing or a sunbed. Heat can make cancer-related fatigue worse, so make sure you drink plenty of fluids throughout the day, unless your doctor or nurse has given you advice about restricting how much you drink. Remember that alcohol or drinks with caffeine in can make you dehydrated, so reduce the amount of these. Animal bites and scratches can cause dangerous infections. It is important to be careful and avoid contact with animals abroad, even if they seem harmless. Animals in many places, especially in Asia, Africa, and Central and South America, can carry rabies. This is rare but a very serious infection of the brain and nerves. It is not found in the UK except in a small number of wild bats. Insect bites and stings are often not serious, but they can become infected. If you do get bitten, try not to scratch, and if you show signs of any infection, get advice from a doctor straight away. You can help prevent insect bites by covering up your skin as much as possible, especially if you go out at night. If you have specific needs, it is important to tell your airline at least 48 hours before your flight. They can arrange for people to help you and for your equipment to be available. The help you can get may depend on which airport and airline you use. In the UK and European Union, if you are less mobile, you have the right to free help at arrival points such as terminal entrances, train stations, bus terminals and car parks, help to reach the check-in counter and help with registration, help with moving through the airport, this includes getting to toilets, help getting on and off the plane, information about your flight in a way you understand, help moving around on the plane, and this includes going to the toilet. If you need help with eating, using oxygen, taking medication, or using the toilet during the flight, another person must accompany you. The airline will try to make sure you sit next to each other, provided you give them at least 48 hours notice. If you use a wheelchair, you cannot take it into the passenger cabin of the plane. Ask the airline to explain what help they can offer instead. The following tips may also help make things easier at an airport. Carry a card or doctor's letter that briefly describes your condition and gives information about any artificial or false body parts, implants or stomas. You may want to show this to security staff as you enter the security area. It may also be helpful to carry a doctor's letter explaining if you need to take medicine, syringes, needles or other medical equipment. Consider wearing a sunflower lanyard if you have a non-visible disability. If you wear a wig, you do not usually need to have any extra security checks, but if a security officer wants to check a wig, you can ask them to use a handheld scanner. This should mean you do not need to remove it. Very rarely a security officer may want you to remove the wig. If this happens, you can ask this to be done in a private space. Some people are randomly chosen to have a body search. If you are asked to have a body search, you can request this search is done by a security officer of a specific gender. The body search is done in a private lockable room. A family member or friend can come in with you. You will not be left alone with just one security officer. If you are travelling by rail, it is a good idea to check with railway companies in advance whether specific train lines and stations are suitable for your needs. Many trains in the UK and abroad are wheelchair accessible. You can ask about train compartments for people who use a wheelchair, lifts or ramps to access the train, help from train staff with getting on and off the train, and suitable toilets. If you are travelling by sea and are disabled or have problems moving around, you have the right to legal free help. Tell the carrier, travel agent, or tour operator when you book, or at least 48 hours before you travel. You can talk to them about if you need help getting on and off the ship, special accommodation, special seating, bring in medical equipment with you. Facilities available on ships can vary. Most modern cruise ships have disabled access cabins, but places may be limited and it's a good idea to book early. There may be restrictions on taking some medical equipment such as oxygen cylinders or large mobility aids. This is more likely to be the case if the ship is small and space is limited, but always speak to the company before you book the trip to find out more. Travel insurance is important to protect you from losing money if something unexpected happens before or during your trip. Travel insurance will usually help cover the following costs: cancellation or curtailment if you need to cancel a trip and end it early. For example, this could be if you or a family member are ill unexpectedly. Personal liability if you injure someone or damage their property by accident. Baggage if your belongings are lost or stolen. Emergency medical treatment if you are abroad. You do usually have to pay for healthcare in other countries, and this can be expensive. Insurance may also help cover the cost of any emergency care you need, included ambulances. It can also help cover the costs of getting you home safely. For example, insurance may cover the cost of flying you home if you need an air ambulance, medical equipment, medical escort, or a carer. A medical escort is a health professional or group of health professionals who travel with you on a commercial flight home. They can provide care and assistance if you are unwell. Travel insurance is not a legal requirement, but without travel insurance, you could end up paying large amounts of money if you were to need additional medical care whilst you were abroad. This is free in the UK. And unlike the UK, many countries do not provide free healthcare, even in emergencies. Before you buy travel insurance, it is important to check what it will and will not cover. Each travel insurance policy varies, so read the terms carefully before you buy. There are two main types of travel insurance: single trip covers, and annual or multi-trip insurance covers you for more than one trip in the same year. If you have an annual travel policy and are diagnosed with cancer during the period of your cover, you should tell your travel company. This also applies to family members' insurance possible. If there's a risk, they may have to cancel a holiday because of your health, so check all policies to be sure. Premium and excess payments is the amount of money you pay for the travel insurance policy. The more likely the provider thinks you are to claim, the more they will ask you to pay. The excess is the amount of money you pay if you make a claim. The excess is usually taken away from the final claim payment. For example, if the excess on the policy is £50 and you make a successful claim for £250, the insurer pays you £200. Make sure you understand how the excess amount is applied because it can vary. You may have no excess to pay, or a single excess amount may be applied for the whole claim. Sometimes travel insurance may be offered as a benefit with your bank or building society, credit card, or home insurance. If you do not already have cover, try to get quotes from different insurance providers before you buy. This can help you get the best travel insurance cover for your needs. It could also help you save money. You can ask for insurance quotes from insurance companies directly, travel insurance comparison sites, and some supermarkets, your bank or building society, or you can use a travel insurance broker. It is important to tell insurance providers about a cancer diagnosis or other pre-existing medical conditions. Some travel insurance policies do not cover claims related in any way to pre-existing medical conditions. You can ask if the insurance provider will allow you to pay a top-up fee to include this cover. There are companies that specialise in providing travel insurance for people with pre-existing medical conditions, including cancer. They may offer you a policy that covers these kinds of claims, provided that you have told the insurer about all pre-existing medical conditions. Medical conditions have been accepted by the insurer in writing. Travel insurance providers may also ask for information about your health before they give you a quote or agree to insure you. They may ask for a doctor's letters confirming you are fit to travel, or they may ask you some questions to help with medical screening. This helps the insurance provider work out how much your policy will cost. They may ask you questions on the phone or through an online form. When you have a medical condition, it is often easier to explain your situation to someone directly on the phone. But be aware that some questions may be upsetting. For example, the insurance provider may ask about the likely outcome of the cancer, and this can be difficult to talk about. Many companies will provide insurance quotes using the same medical screening questions and a computer system. If the questions are not suitable for your situation, tell the insurance provider. It's important that they understand the situation fully so they can offer a policy that is right for you. Some of the questions they may ask may include where and when you are travelling, the length of your trip, any health conditions you have, any ongoing tests you're having, when you were diagnosed, where the cancer is or was, whether the cancer has spread to other parts of the body, what treatment you have had or are having, any surgery you have or have planned to have, details of any medicines that you take, any symptoms or side effects you have, how advanced the cancer is, and details of the GP hospital or specialists that you have visited over the last year. You can use a global health insurance card or a European health insurance card in some countries to show you have the right to state-provided healthcare. This means you have the right to access the medical treatment a resident of that country would receive at the same price. Having a GHIC or EHIC is not the same as having travel insurance. A GHIC or EHIC only covers emergency or necessary medical care. You can use these cards in some countries to show you have the right to state-provided healthcare. If you become unwell, you may be able to show it to access the medical treatment at the same price. These cards are free to apply for and you can carry it when you travel. What cover you can get depends on the country you are in. The healthcare may not be the same as the care in the UK, and you may still have to pay part of the cost yourself. Some countries do not accept these cards, so always check before you travel. In some countries where you need to pay the full cost of any healthcare, keep all receipts and any paperwork. You or your insurance company will need these to apply for a refund. If you do not have your card with you, you can apply for a provisional replacement certificate to use instead. Someone else can apply for you if needed. Please remember, these cards are not a replacement for travel insurance. They will only cover emergency or necessary medical care. It is sensible to think about what you will do if you become ill while you're away. Being prepared can make things easier and less stressful if this happens. Emergency contacts are also another important planning document. You may want to take contact details for close family or friends with you. Check that their details are up to date. In an emergency, someone can contact them if you are not able to. And if you are travelling abroad, you can keep these contact details with your passports. Make sure that you plan for any unexpected costs. In the UK, call 999 for emergencies and for non-urgent or minor illnesses, visit a pharmacist. If you are abroad, make a note of emergency services phone numbers. We hope you find this presentation useful. For more information, you can visit the Macmillan website, call or pop into your local information centre, access the Macmillan online community, or call the National Macmillan Helpline. The Macmillan Travel and Cancer Booklet can provide useful information and is free of charge. This can be picked up from your local information centre, sent directly to your house, or downloaded as a PDF on a mobile device.